Hey everybody, welcome back to Defeating Hair Loss. My name is Steve, and I'm lucky again, I'm so lucky, Bobby, to have Bobby back with me,
Steve.
Bobby D.
Appreciate it.
I'm supposed to be the guy with all this content and knowledge, and hopefully that's coming across, but that's the model, that's the guy with the hair, that's the example of what you want to look like eventually if you've got any issues, and you probably do with your hair by watching this channel. So how you doing?
I'm good, Steve. How are you doing?
I'm doing great.
I always appreciate the kind words every time. Boost the mic.
Everybody that knows me through all my years knows that if I don't have anything nice to say, I won't say it at all, but I tell it like it is.
That's true.
You look fantastic. You're in great shape. You got great hair, but it's a whole package, right?
Yes, I try to.
Speaking of the shape thing, we're going to be going out into the gym at some point.
Oh,
right?
yeah, we are.
So, I need a bodyguard now these days. And Bobby's going to come with me, and we're going to hit the weights, and we're going to bring the tie-in of the image of how hair affects us in all aspects of life, especially in the gym. So we kind of wanted to do a little something different tonight. You had texted me over the past week, and you had a question, right?
Yeah, Steve. I was out with some buddies at the bar, drinks were flying and stuff. And somebody asked, Bob, you've had some hair transplants and, it turned out well for you, but was there any, possible risk of having a hair transplant, Steve? And, what are your thoughts on that?
So it's a great question. And before I even answer it, Bobby, I want to make it clear to everybody that I do not take for granted anybody's, how should I say this, education level or level of education in hair restoration, hair preservation. Now, again, Bobby makes a great example of just about everything from A to Z. He was a young guy. He started exploring this. He's kind of like was hurting. He was out there researching, and I did my best to kind of fill him in on what he needed to continue to research and any of the what we call risk-reward ratio, right? We talked about medication. We talked about the two different procedures. We talked about the various board-certified doctors in your area. That's pretty much what I do with everybody. But that is a great question because I think as professionals in this industry, and I'm happy to, on YouTube and also out there in other forums, to share these platforms with guys that really know what they're talking about. And we all seem to take for granted that everybody out there knows this stuff like we do, which, to me, it comes natural because I lost my hair so young and I had to just start hitting the books and at those days or hit the magazines or the newspapers. There was brochures. There was not a whole lot of anything else. So to answer your question, Bobby, and this is a great question, is what am I at risk for? So this video, although I don't like to do these kind of things, may scare some of you out there, and they're way down, they're way off in regards to what can happen. But it's a good question. So what are the risks? So I came up with 5, and number 1 is necrosis. That's really scary. So anytime you have a surgery done and your doctor does not really know what he's doing, you can have necrosis, which means that, you have basically killed the tissue and the blood doesn't flow there anymore because the skin is so beat up. It's just really scary. If you Google it, you'll freak out, and it's not going to happen to anybody out there probably watching these videos because, David DiMuzio's had his hair surgery done with the top surgeon, Dr. McGrath. As a matter of fact, both of us have as well. But he has colleagues, and there's other doctors I represent that you don't even have any risk at all in regards to worrying about necrosis. But since we're on the subject, smokers, sometimes they come in and they lie to you. They don't want to, but they do. They don't stop smoking. And they say, yeah, I stopped smoking. And a smoker has very poor circulation. So what can happen is the doctor, he's all motivated and he's making the sites, meaning it's a fancy word for holes and where we're going to place the grafts. And then he ends up putting them so close that there's not enough blood supply because of the poor circulation. The skin doesn't get the proper blood supply and it kind of dies, and it's nasty. It can look like a big cut that doesn't heal on the top of your head. So that's a really scary one, and I haven't seen an example of that in a long time. Last time was probably when I Googled, just like you do, and saw some really bad pictures of, some of these doctors who may not even be doctors in some foreign countries. That can happen. So that's a risk. Number 2 is nerve damage from, both FUE and FUT. Now we'd like to pick on FUT as an industry because, you're going to kind of go into an actual surgery, whereas FUE is surgery as well. You're just making these tiny little holes. If it's done wrong, whether it's FUT or FUE, you can have nerve damage. Let's stick with FUT. If the doctor has not been trained, he hasn't gone through a fellowship, he has not done more than maybe 5 FUT surgeries, and he's got a little bit of a challenge with the patient, and he goes too deep, he may end up doing some damage to some nerves. Now, by today's standard, even the worst cases, usually that'll all grow back. But that is a risk, and we want to be careful with that. And again, it's just an example to watch our videos to make sure we help and guide you on how to pick the most qualified surgeon in your area. Number 3 is scarring. Now, Bobby, you were going back and forth between FUE and FUT like everybody else. And now you've got that really cool haircut.
Yeah, it's all right.
And you have no problems with scarring. At least you've had no problems with scarring through the procedures. I don't want to put words in your mouth, but you feel real comfortable with your scarring.
Yeah.
And
for sure.
And I will put words in your mouth. So then, besides that actual scar back there, which is just one on the top and on the bottom and all around, you've got full density in your donor zone, and you're still really young. And you're out there now rocking and rolling, that if God forbid something would happen, you'd have more hair loss, which you're not going to have because you're on the medication. You've got plenty of hair for other procedures. So no big deal with scarring. Now, if scarring happens to you, this is a whole nother video, a whole nother conversation. Whether it's FUE or it's FUT, everybody's different. And it really depends on how you heal. Not how he heals, not how I heal. It's about how you heal. So we want to be very careful with estimating or kind of surmising that scarring can be normal for everybody in regards to a perfect scarring. We want to be careful. We always want to plan for the worst, hope for the best, and again, choose that really good surgeon who has a lot of experience, a lot of years, and can show you examples of best case, worst case. Keep in mind that most of the scarring in hair transplant surgery, all the scarring is actually in the donor zone, and it can all be kind of manipulated and corrected if something goes wrong as well. Meaning, FUE fill in for an FUE fill in for an FUT scar. We can also do FUE fill in from beard hair to FUE scars. So there's a lot of different ways we can work with scarring. So it's not the worst thing, and you're gonna have scarring. Don't let anybody tell you you're not. Number 4 is hair shock. This one's a little scary, but it's not like, jumping off the page scary. This is kind of like, hey, I went and saw a doctor. You sent me to him, Steve. He wants to do 3,000 grafts. I got diffuse thinning. You warned me, Steve, I can get some hair shock. Yeah, that's, it's a challenge. Female patients are not good candidates because of that. Just imagine if we go around every single hair to try to double the density. What if all that native hair shocks out? Well, the good news about shock, I think it's good news, mostly all the time in all my years doing this and really paying attention to people that have had issues, talking to other guys like me and doctors, that hair shock will grow back. It just takes a really long time.
Yeah, I can say that happened to me. I had hair shock and I was bothering you about it, and then just luckily it came back. So
I don't remember that. Were you bothering me about that?
I always bother you, Steve.
So yeah, hair shock so it happened to you, but did it happen on a large scale or?
Just a little bit. I noticed it. Yeah.
Yeah.
Right
So
after the surgery.
So I like to say you can take a baby step back before you take 2 steps forward, and that's when you have some hair shock after a treatment. But again, it takes about 18 months. It's also known scientifically as telogen effluvium, and this is something that you should prepare for just in case. Just in case. Okay, the last one, the one everybody wants to talk about and ask is, what if the hair doesn't grow? Whew, man, I don't know.
That's an happen.
So if we really look at it, I'm sure we could find, if we all spent a day researching to find a patient out there somewhere where the hair transplant didn't grow. Couple things. Number 1 is that if it's done properly, if you are given a proper consultation when you see your doctor and he examines your donor zone, and he also goes through your health history, and we talk about what kind of medications you're taking, are you a smoker, are you a diabetic, and ways that we can manage your health along with hair transplantation based on recipient area donor zone. That doctor should be able to guarantee that hair is going to grow. If that hair doesn't grow, and you've gone through all that, I got to start Googling myself because it just doesn't make any sense. Now, one of my biggest pet peeves in this industry is that doctors, maybe not board certified doctors, but doctors are doing wrong surgery on patients that are not good candidates. So they kind of do surgery on everyone, thinking they're going to help them, or maybe they're going to make some money on them. And maybe they shouldn't be doing surgery on them. And that's really if you have poor donor hair. Not a good candidate. You should not, at least at that very moment, entertain a surgery for a patient. So there's a better chance of hair not growing from patients that have poor donor hair. And basically what happens is that the hair never had a chance because while it was being extracted, whether FUE or FUT, it was damaged because it's so weak and then it doesn't grow. So we never even had a chance for it to grow. There are patients out there I've seen over the past, say, 20 years that can get some poor growth. And, it's just a matter of them being really bald and having really, really challenging donor hair. And what I just said is true. These doctors want to help them. But again, we want to set up realistic expectations and make sure that you're prepared for that. So the does not grow thing is not going to happen as long as you're properly diagnosed. And these are 5 side effects. You can bring these back to your friends, have a few more beers, talk about their hair surgeries. And again, not to scare anybody, this is just really good content, good information for you to make sure you're aware of these risks and make sure you're prepared for them and speak to your physician about it. How'd that go?
Sounds good, Steve.
My
Good
Bob.
job.
Don't forget to like and subscribe.